Hi, I'm Brittany Montez, and this is the Orlando Health News Review for August 20th. Baptist Health has entered into a 10-year partnership to become the official medical partner of Samford University Athletics. For more, let's hear from Baptist Health Chief Financial Officer Amy Wheeler and some of our friends at Samford University in Alabama.
You know, they're a hometown team. And so being able to take care of those athletes that put in the hard work day in and day out to really just provide some excitement to the Birmingham community, we're excited to be a part of that. We have wonderful, highly qualified orthopedic surgeons and clinicians already hired into our system that will help support those high quality athletes in the community.
There's a strategic alignment with mission and vision and the values that both organizations have. We both are committed to excellence, serving at a high level, providing the first-class quality care that we both desire and need for our constituents, and they're right down the street. So great partnership. They're bringing a lot of resources to our university, and we couldn't be more excited to welcome such a stout partner for Samford Athletics into our families.
And next, a patient story from Orlando Health Sebastian River Hospital.
I am an assistant principal at St. Peter's Preparatory Academy. Our campus has 2 buildings, and I'm constantly walking from building A to building B and building B to building A. And then about 8 months ago, my right knee went, and I was lucky enough to find Dr. Sullivan.
She had arthritis, which is basically when the cartilage wears out in between the femur and the tibia. So when that happens, you can get to be what's called bone on bone when there's no cartilage left. And because most of her arthritis was in the one side of her knee and just one portion of the knee, I told her that I think a partial knee replacement would be a very good option for her to get her back on her feet a lot quicker.
I went in the hospital at 5:30. They operated at 7:30. And at 3:30, I was home at my daughter's home.
Overall, the benefit is that the recovery is a lot quicker. So it probably halves the amount of time in recovery for most people. Only a couple weeks after surgery, she was walking without any assisted devices. I mean, she did amazing.
I wouldn't have been able to do my job if I had not had a knee replacement. You don't need to be in pain today because of the techniques they have today and the procedures.
And Orlando Health was recently featured on Channel 6 News. During a routine ultrasound at Orlando Health Winnie Palmer Hospital for Women and Babies, Courtney Anderson and her family learned that their baby had spina bifida. Surgeons performed a high-risk open fetal surgery to repair the spinal defect while baby Phoenix was still in the womb, a procedure that can help reduce long-term complications.
If you could describe finding out all of this in one word, what would it be and why?
For us, it would probably be lucky, because we found it early and we found his team to help him.
Dr. Arbaba, for the person who's sitting at home right now who doesn't understand what spina bifida is, explain to me what that is.
So spina bifida, in a nutshell, it's a congenital malformation affecting the spine, and unfortunately it can impact development of the brain, and most kids with spina bifida will have an impact for the rest of their lives.
Mom, walk me through the start of this journey for you.
Yeah, so we went in for our normal routine, finding out if he was a boy or girl, ultrasound time, and found out that he was a boy, and also that something was wrong in his head, that the cerebellum, they couldn't find it.
At around 19 to 21 weeks, the detailed anatomic survey that looks at everything on the baby head to toe will hopefully identify these types of defects, either because of the defect itself in the back or the findings within the brain.
Obviously, this is a very serious intervention and a high-risk procedure on 2 human beings. You're operating 2 patients at the same time.
There's also the additional post-surgical risks of possible ruptured membranes, preterm labor, and then the fact that you have an incision placed on the womb during the actual pregnancy, and while that's healing, you have a baby growing inside.
Kicking you the whole time.
Yeah, as Courtney did, you have a baby growing inside.
When you look at Phoenix, what do you think?
I'm amazed, and I also think the word that comes to mind is optimism. You know, really so much of what we do is giving these families hope and opportunity, and that's really what we want to do here in Central Florida and really around the world.
And we did it again. Orlando Health is proud to have earned a Great Place to Work certification for 2025. This certification is based entirely on feedback from team members who shared their thoughts in a survey about what it's like to work at Orlando Health. This global certification recognizes outstanding places of employment and makes us eligible for multiple Best Workplace awards from publications like Fortune and People magazine.
Thank you to all our team members for all you do to earn this incredible recognition. Feedback from surveys like this is important to our commitment to be your best place to work. This year, 88% of you shared that Orlando Health is a great place to work, while 92% of you shared you're proud to tell others you work here. These are impressive results and reinforce that we are on the right track to embrace and enhance a culture of caring. I encourage all team members who received the survey, whether it is Great Place to Work, Orlando Sentinel Top Workplaces, or our Glint survey, to take a few minutes and share their thoughts and ideas with us.
And here are a few dates to know. Check Swift for all the details. That's it for today's edition of the Orlando Health News Review. We'll see you next week.